Welcome to the Mom Talk Show, where we believe that being an informed mom is key to recognize problems at an early age. As a mom in today's world, facing challenges can be overwhelming, but having the right support can make all the difference. Our mission is to provide helpful and trustworthy information to support you on your parenting journey. Welcome to Mom Talk, the talk show for mom. Today we're going to do an update on respiratory virus with Dr. Céline Bergeron. Céline is a lung specialist at VGH, Vancouver General Hospital. Welcome, Céline. Welcome to Mom Talk.
Thank you, Geneviève. I'm very pleased to be here today with you.
It's awesome to be with you, and we'll be talking about viruses. So please give us an update. What's happening now? There's COVID-19. There's so many new things in this world about, especially when we talk about respiratory viruses.
Yeah, that's the main new thing, is the COVID-19 that we all heard about in 2020 that I think affected us. Many people in different ways. Not everybody had it, but I think the general population understands better now what is a respiratory viral infection than before. COVID-19 is one of the new viruses, but there's like hundreds of other viruses that has been with us since ever, that are causing those common cold and the flu, and that we need to deal with it on a regular basis.
Yeah, and of course now, I want to talk about children, right? Mm-hmm. So how does a cold manifest in children?
It's kind of the same as in adult too. There will be sneezing, nasal congestion. You can have sore throat, feeling unwell like malaise, bit of fever. When the fever is very high, you will think more about the flu. The common cold would be, low-grade fever usually.
So, guess when you see a fever, is it more like because it's a flu? So it's a different virus.
You can have mild fever with the common cold also, but with the flu, typically you will have like higher fever, like 39 or more. Mm-hmm. It will not diagnose flu exactly when you have higher fever, but we see more high-level fever with the flu. Okay. The flu is the influenza. The common cold is usually rhinovirus. There's hundreds of them, different type of rhinoviruses, and there's other type of viruses too. There's parainfluenza virus, there's other coronavirus that we've been living with for many, many years. The respiratory syncytial virus is another one too that is part of our family of the respiratory viruses. I was thinking of another one. Yeah, the adenovirus too. That's another one. Okay. That one, you have red eye when you have it too.
Okay.
Yeah.
And we hear sometimes, or we heard in the past, the SARS virus. Where is that, where is it located in that whole family?
That's part also of a coronavirus. That was kind of new in the last, I will say, 15 years. Yeah.
Okay. Lately, we heard about a new type of cold or flu. I can't remember, how did we call it?
It was the respiratory syncytial virus.
Okay.
That was like a big boom in the fall. We always had that every fall or over the holiday time, that viruses, but with all the precaution we had in the last few years with COVID or not seeing anybody for the first year, there were less of those respiratory virus running around. So it kind of, with things opening up and less mask in school and stuff like that, there were more transmissions. So lots of kids going to the emergency, even adult too with that, but going to the emergency with that respiratory syncytial virus. The thing with that virus is it can still be in your nose, like nasal congestion, sore throat, sneezing. The first couple of days is usually that, but it can get down in your airways, lower airways. So in your small airways, it gets there. So you will be wheezy, lots of cough. And for young kids, like 2 years and younger, the airway are so small, they are very collapsible, so they are making a lot of noise when they're coughing, and it can block, and it can be severe to the point that the oxygen will drop and they will like work a lot for breathing. So they need to seek medical attention for sure. So not everybody with RSV will be at that level, but it's a possibility, yeah.
So how frequent children compared to adults like get the flu or virus? Is it the same or is it different? Or
well, in statistics,
you hear children are always sick.
Yeah. So that's interesting. So you want to know what is the number that is normal? Yeah. There's some statistic there. In average, 6 to 8 cold, episode per year for children below 6 years of age will be like normal. So if it's more than that, you might question but 6 to 8, which is kind of frequent. In adult, or children above 6, and adults, we talk about 2 to 4. So, younger in age, you haven't been exposed, you need to build your immunity, and then as you get older, you're less, you get less frequent cold, yeah.
So I guess our immune system with time plays a big role in fighting those colds earlier, but I want to go back to the syncytial virus, right? Can you explain to us a little bit more what it is, and because it's more of a
that's a virus. Right? The respiratory syncytial virus, that's the one that will cause in young kids the bronchiolitis. So that's the small airway when they have that inflammation, and that can be severe. Go to the emergency because you don't have enough oxygen and your work of breathing is so hard. It can look like a bit like an asthma attack, but it's caused by a viral infection, so it's not. The flu, it's the influenza. So it's another virus. There's different type of influenza, like most of the viruses, they have different types. But yeah, the flu is influenza, and we have vaccination every year that they change the component of the vaccine every year to target the type of flu that we think will come to us. So they check in other part of the world what type of flu is coming. And then they're doing the mix, and then we will have the flu vaccine in the fall to protect us for the winter. Yeah.
So now, can you give us a few tips at home if we have a little one, or even for us, we have cold, we have the flu, what should we do, what should we look for, when should we go and see a doctor?
Yeah, well, most of the cases you don't need to see a doctor. You're just going to take care of yourself at home. You're going to rest, hydrate well. You lose a lot of water with all those secretion, and you're breathing a bit, maybe sometimes more fast. So you need to hydrate well. It helps. Take Tylenol if you feel unwell, muscle pain, or a headache, or fever. That will help with acetaminophen, Tylenol. There's no specific viral treatment, except
virus, right?
Except for COVID, we have medication, and for the flu, there's medication also to treat, so viral treatment. But for the other viruses, we don't. We used to have one that was partly working for the RSV, but it's not available anymore. So, so there's no antibiotics will not fight the flu. The antibiotics are for bacteria, so for common cold or flu or COVID, that will not work. So you need to take care, usually 5 days, 7 days. RSV, the respiratory syncytial virus, will be a little bit longer than that, a good 2 weeks, and sometimes many weeks, like 6, 8 weeks of coughing after. We can see that. Try to not give it to other people. So isolation, wear a mask if you have to go outside, and wash your hands all the time, especially if you're sneezing or blowing your nose in a tissue, and to prevent, you have the vaccination.
That was my last question for you. I want to know the prevention. Vaccination.
Yeah.
And?
Well, the vaccination, we have vaccine for COVID-19. We have vaccine for the flu. We don't have vaccine for the other viruses, and there's hundreds of other viruses. Maybe one day, and it's face mask and washing hands, especially when you're close to people. Let's say you take a plane to travel. You don't know who's sitting beside you, in front of you, so that's kind of smart to wear a mask in a plane. If you're commuting in transit, there's lots of people. If you keep safe distance from other people, you're usually fine. Like I usually do that, and I can see that kind of touch. Yeah, you're kind of that you're in your bubble and you should be safe. But if you're stuck and squeezed in between other people, this is where you're at risk.
The elevators, right?
Elevators, yeah, that's. Yeah. But usually you don't spend too much time in the elevator. But if you're in a train, like stuck for half an hour, there's possibility of significant contact.
Well, thank you so much, Dr. Bergeron. It was a pleasure to have you with us. Specifically, I know you're very busy, like all of you guys at VGH. So thanks again. For all the moms that are listening to us, to contact us or to view all our available episodes, please visit our website at mom-talk.ca. We're also available on YouTube at Mom Talk or at the Tri-Cities Community Television YouTube channel. If you're an expert, don't hesitate to contact us. We want to hear from you. Maybe you want to come on the show. Mom Talk would like to thank our generous sponsor, the Tri-Cities Community Television and La Société Francophone de Maillardville. If you're a mom and you would like, if you know a mom that would benefit from listening to this episode, please share this episode with her. Always remember, it's important to laugh, keep learning, cherish your village, and be true to yourself. I'm Genevieve Carla-5, and thank you for joining us.
Visit us at mom-talk.ca to access our podcast library and stay up to date with our latest content. Follow us on social media for more tips, hacks, and inspiration. Thank you for joining us on this exciting journey of motherhood.